Welcome back to Senior Healthty Care, where you will discover several recommendations for seniors. Today, we provide essential suggestions for seniors that cannot be overlooked. Over 50 build strength and balance with safe isometrics. Preserving physical strength, stability, and autonomy is a significant health issue for those over 50 years of age. With advancing age, several physiological systems undergo alterations that may impair mobility and heighten susceptibility to injury. Two prevalent conditions, sarcopenia characterized by the slow decline in skeletal muscle mass and strength, and osteoporosis, marked by the continual decrease in bone mineral density, converge to elevate the chance of falls, hinder the capacity to execute daily activities, and diminish quality of life. Even little decreases in muscular strength or confidence during movement may result in reduced walking speed, challenges in rising from a chair, difficulties in carrying goods, and an increased probability of dependence for daily tasks. Due to the prevalence of arthritis, previous joint injuries, balance impairments, or insufficient experience with organized resistance training in older persons, traditional high-impact, high-velocity, or heavy ballistic exercise regimens are often unsuitable or unappealing. Isometric exercise is an efficient, low-impact, and accessible option with a favorable risk-benefit ratio for several older persons. Isometric training involves voluntary muscular contractions that generate force without any detectable change in joint angle or muscle length. Instead of executing a limb through a repetitive range of motion, the practitioner sustains a static position against an unyielding force, exerts pressure against a stable surface, such as the floor or wall, or retains a body segment in a consistent posture under persistent stress. The continuous contractions, known as holds, generate considerable time under strain, efficiently recruit motor units, and may provide substantial improvements in strength and endurance, while reducing repeated stress on vulnerable joints, including the knees, hips, shoulders, and wrists. This article offers a comprehensive explanation of three fundamental isometric holds: the push-up hold, the plank, and the squat hold, that together target primary muscle groups, core stability, and balance. It elucidates the suitability of isometrics for aging bodies, provides comprehensive step-by-step instructions, along with various accessible modifications. For each hold identifies common technical errors and their rectifications, and offers succinct, adaptable programming templates that require minimal or no equipment. The focus is on functional strength enhancements that directly apply to daily activities such as rising from a chair, lifting and placing bags, safely navigating stairs, and maintaining stability during unforeseen disturbances, thereby promoting long-term independence and quality of life. The suitability of isometric training for elderly persons. Comprehending why static contraction is particularly advantageous for those over 50 necessitates a concise examination of muscle mechanics and principles of safe loading. Muscle activity is often classified by the kind of contraction. Isotonic contractions include movement, concentric actions shorten the muscle while producing force, e.g., lifting a weight, while eccentric actions lengthen the muscle under tension, e.g., lowering the weight. These dynamic activities are very successful for augmenting muscle development and strength. Nevertheless, repeated motion and eccentric loading may sometimes induce joint discomfort, tendon irritation, or delayed onset muscle soreness in predisposed people. Isometric contractions are characterized by the generation of force by the muscle without significant joint movement. The opposing force matches the force exerted at a certain joint angle, resulting in a stationary limb. Maintaining a static posture for a specified duration engages a significant number of motor units and may enhance maximum voluntary contraction and endurance at or near the training joint angles. Isometrics may therefore fortify muscle while reducing repetitive shock acceleration and deceleration forces that may aggravate degenerative joints or susceptible tendons. Particular physiological advantages. Isometric exercise has several specific benefits for older persons. Joint-friendly loading. Isometric exercises diminish repeated motion and high-velocity eccentric loading, which often aggravate osteoarthritic pain, tendinopathy, or bursitis. The fixed joint minimizes compressive and shear forces from cyclic movement, allowing for safe challenges to the muscles. Duration of stress and strength enhancement. Prolonged holds, often 10 to 60 seconds depending on capability, facilitate motor unit recruitment and muscular endurance. Enhancements in force generation from isometric exercises may lead to improved performance in functional activities, such as pushing, lifting, and transferring, particularly at the specific joint angles treated. Core and postural stabilization. Numerous static holds effectively activate deep trunk stabilizers. And well-coordinated core protects the lumbar spine, maintains an upright posture, and facilitates the efficient transmission of forces between the upper and lower bodies. Enhanced trunk control reduces compensatory motions that may result in falls or overuse injuries. Support for bone health. Isometric holds executed in weight-bearing postures expose bone to compressive and shear pressures. Although high-impact activities are frequently advised to effectively stimulate bone remodeling, prolonged weight-bearing isometrics, such as push-up or squat holds, exert mechanical stress that can aid in preserving bone mass when integrated with a generally active lifestyle and suitable nutrition. Neuromuscular control and equilibrium. Isometric exercises enhance the nervous system's ability to recruit and coordinate motor units effectively, while stabilizing joints under stress. This improves proprioception and reaction stability, essential abilities for preventing falls when balance is suddenly compromised. Accessibility and convenience. Isometric exercises often want no specialized equipment may be executed in confined areas and are readily adaptable to accommodate individual requirements and advancement. They are well suited for home-based programs and quick, frequent practice sessions. A pragmatic warning on blood pressure and respiration. Prolonged isometric contractions may induce temporary elevations in blood pressure, particularly during breath-holding, the Valsalva maneuver. To reduce cardiovascular strain, maintain continuous and even breathing throughout. Holds inhale through the nose and expel through the mouth in a consistent rhythm, deliberately avoiding breath holding. Individuals with uncontrolled hypertension, unstable cardiovascular disease, recent cardiac events, or certain other cardiac diseases should seek medical advice before beginning an isometric program. Cease all activity and get medical assistance immediately if you have dizziness, chest discomfort, acute shortness of breath, or palpitations during exercise. The isometric upper body exercise push-up hold. The push-up hold tests the upper body and a significant section of the core. The traditional push-up entails the continuous lowering and elevating of the torso, but the isometric push-up hold necessitates the muscles to maintain a static load-bearing stance. This method preserves the advantages of strength and stability associated with the dynamic push-up while mitigating joint stress from repeated movement. Targeted muscles. The push-up hold engages a series of muscles essential for daily activities. Pectoralis major and minor chest principal muscular power used in actions such as opening doors, propelling a shopping cart, or elevating oneself from low surfaces. Anterior deltoids, front of shoulder, facilitate pushing and reaching movements. Triceps brachii facilitates elbow extension during the propulsion of items. Core muscles. Rectus, abdominis transverse, abdominis obliques sustain spinal alignment and avert hip drooping. The serratus anterior stabilizes the scapula against the rib cage and safeguards shoulder health during pushing activities. The hip extensors gluteus maximus and quadriceps facilitate a rigid body alignment and enhance hip stability. Standard high plank push-up hold detailed procedure. 1. Assume a quadrupedal position with hands positioned behind the shoulders and fingers splayed to evenly distribute pressure and enhance stability. 2. Extend or elevate the legs, sequentially rising onto the balls of the feet to create a straight, rigid alignment from head to heels. 3. Maintain a neutral pelvis, a little posterior tilt, slight tailbone tuck aids in preventing hip sag. Gently contract the glutes to stabilize the hips. 4. Draw the navel towards the spine to activate the transverse abdominis. This is a stabilizing motion for the trunk, not a breath-holding contraction. 5. Apply pressure to the floor with your hands, envisioning the process of pushing the floor away. This promotes mild protraction of the scapulae and activates the serratus anterior muscle. 6. Maintain a little micro-bend in the elbows. Refrain from hyperextension or joint locking. 7. Keep the neck neutral by focusing on a location on the floor several inches forward of the hands. 8. Inhale consistently and maintain the position for the designated duration. Suggested durations: novices 10-20 seconds, intermediates 30-60 seconds. For those who are significantly deconditioned, begin with 5 to 10 seconds and progressively increase the duration. The programming part addresses frequency and set structure, alterations and advancements. Offering various regressions and progressions, customizes the push-up hold to individual capabilities. Knee push-up hold: descend the knees to the ground while maintaining a straight alignment from head to knees. This alleviates strain on the shoulders and core and serves as a typical starting position. Incline push-up hold: position hands on a firmly raised surface, countertop, bench, robust chair. Elevating the hands facilitates the grip. Reducing the angle enhances the need. Decline push-up hold: advanced, raise the feet on a bench or step to enhance shoulder engagement. Proceed with caution. Single leg push-up hold: elevate one foot off the ground to enhance rotational core engagement. Do this only after achieving bilateral 60-second holds with proper technique. Band assisted: hold secure a resistance band around the upper back and attach it above to modify load distribution and enhance performance at certain joint angles. Beneficial for optimizing load in rehabilitative contexts, but often unnecessary for the majority of older persons. Frequent mistakes and their rectifications: sagging hips often indicate inadequate activation of the posterior chain or core muscles. Engage the glutes consciously and retract the navel inward. If exhaustion swiftly leads to failure, revert to a simpler form. Elevating hips butt raised diminishes core engagement and redistributes load. Instruct to descend hips until a straight line is established, ensuring activation of the glutes and quadriceps. To alleviate neck discomfort, push the floor away while allowing the shoulder blades to glide gently down the back, so reducing tension in the shoulders and neck. Envision establishing a gap between the ears and shoulders. Head droop: maintain a neutral neck position by gazing slightly ahead rather than downward at the hands. The plank and isometric exercise targeting the core. The straight arm plank resembles the push-up hold, but prioritizes total body tension and core endurance, preventing undesirable spinal movement under load. A strong core is essential for the safe and effective transmission of force during daily activities and for safeguarding the lumbar spine from excessive strain. Activated muscles. A straight arm plank engages a wide array of muscles that facilitate posture and intersegmental force transmission. The transverse abdominis rectus, abdominis, and internal and external obliques counteract spinal extension and rotation. Spinal erectors maintain the back in an erect posture. The gluteal muscles support the pelvis and inhibit lumbar hyperextension. Quadriceps and hamstrings sustain knee extension and lower limb stability. The pectoralis major deltoids, latissimus dorsi, and rhomboids regulate scapular and shoulder posture. Executing the straight arm plank 1. Assume the push-up hold posture with hands positioned just behind the shoulders and arms fully extended. 2. Position the feet at hip width for stability. Reducing the stance enhances the difficulty. 3. Establish comprehensive bodily tension. Tense the gluteal muscles, activate the quadriceps, stabilize the core as if bracing for a gentle blow, and apply pressure with the palms on the floor to gently protract the scapulae. 4. Preserve a neutral spine from head to heels and breathe consistently over the duration of the hold. 5. Maintain for a duration according to capability. Suggested durations: beginners 10 to 20 seconds, intermediate and advanced 30 to 60 seconds. The forearm plank serves as an outstanding option for those with wrist complications. Variations of the plank exercise and their accessibility. Forearm planks support the body on forearms with elbows positioned under shoulders. This minimizes wrist extension and may provide more comfort for those with hand arthritis. Incline plank position hands on an elevated surface to reduce strain on the shoulders and core. Knee plank assume a kneeling position, maintaining a straight alignment from head to knees, suitable for novices or anyone with lower limb constraints. Modified side plank, executed on a forearm with the lower knee flexed for support, engages the obliques and lateral chain-enhancing single-leg stability. Advanced learners may use dynamic choices such as quick taps of the opposing hand to the floor, alternating toe taps, or gradual micro-shifts side to side to enhance reactive stability. Frequent mistakes and indicators: lumbar hyperextension, sagging often due to inadequate core engagement or exhaustion. Re-engage the core and gluteal muscles. If the posture remains unsustainable, decrease the duration of the hold or revert to a simpler version. Piking hips instruct to descend to a neutral position while enhancing glute and abdominal activation. Breath holding: use a rhythm, for instance, inhale for 2 to 3 seconds, exhale for 2 to 3 seconds, or gently count to sustain cadence. Forearm plank hand position: refrain from firmly clasping hands as it may encourage internal rotation of the shoulders. Maintain palms flat or use neutral fists if preferred. Isometric exercise for the lower body squat hold. The squat hold enhances lower body strength and stability while reducing recurrent joint stress. Squatting is essential to everyday activities, standing from seats, ascending stairs, and bending to get items. Thus, the ability to maintain and regulate a squat posture immediately enhances autonomy. Targeted muscles. The isometric squat activates the primary muscles of the lower body and torso: quadriceps, principal knee extensors, crucial for elevation and stabilization; gluteus, maximus medius, and minimus hip extension, pelvic stability, and lateral equilibrium. Hamstrings facilitate hip stabilization and reinforce the posterior chain. Adductor stability of the inside thigh, crucial for single-leg movements. Core muscles sustain an erect torso and spinal alignment. Standard bodyweight squat hold, detailed procedure 1. Position your feet at a distance ranging from hip width to shoulder width apart. Toes may align directly front or angle slightly outward, 5 to 15 degrees, based on comfort and hip flexibility. 2. Bend at the hips first, thrusting the buttocks backward as if descending into a chair. This aids in maintaining equilibrium and safeguarding the knees. 3. Elevate the chest and direct the gaze ahead to maintain a neutral spinal alignment. 4. Flex the knees and descend the hips. Equally distribute weight throughout the foot with a small focus on the heels. 5. Descend until the thighs are parallel to the floor if feasible. If mobility or discomfort limits depth lower simply to a comfortable level, hips slightly above the knees still provide significant stimulation. 6. Ensure that the knees align with the second and third toes and do not fold inward, prevent knee valgus. 7. Engage the core and maintain a steady breath while in position. Suggested durations: novices 10-20 seconds, intermediates and experienced practitioners 30 to 60 seconds. Severely deconditioned persons may start with 5 to 10 seconds and progressively augment the duration. Alterations and advancements: wall squat, wall sit, descend against a wall and maintain the posture with knees at about a 90-degree angle. This provides trunk support and serves as a great entrance point for those with balance impairments. Box-supported squat hold: descend to the edge of a chair or box and maintain a supported sitting posture, facilitating partial weight-bearing and enhancing confidence. Stance width. Altering the base of support engages distinct muscle groups. A wide stance accentuates the adductors, while a narrow stance heightens quadriceps activation and tests balance. Advanced single leg squat hold. Transfer weight to one leg and execute a shallow single leg hold. Proceed only with proficient bilateral control. Incorporate little pulses, regulated micro movements at the base for expert practitioners to enhance time under strain judiciously. Frequent mistakes and their rectifications. Knees collapsing inward prompt an outward push of the knees in alignment with the toes. Using a modest resistance band around the thighs may strengthen the motor pattern. To correct a rounded back, elevate the chest, gently retract the shoulders, and engage the core. Decrease depth if needed. Redirecting weight onto the toes, instruct to redistribute weight via the midfoot and heels to safeguard the knees. Emphasize a gradual controlled fall to safeguard joints and enhance muscle control. Integrating the 3 holds into a streamlined regimen. The 3 isometric holds, push-up hold, straight arm plank, and squat hold, can be integrated into a concise, effective total body regimen that requires less than 10 minutes. A brief warm-up lasting 2 to 3 minutes readies the joints and muscles. Arm circles, 30 seconds forward, 30 seconds backward, gentle torso, twists, 30 seconds, leg swings, front to back, 30 seconds per leg, ankle circles, 15-20 seconds each, and 5 to 10, slow controlled squats to promote mobility without inducing fatigue. Circuit configuration. A basic circuit executes the push-up hold, plank, and squat hold in succession with short rest intervals. Maintain each posture for a certain duration, often 15-45 seconds dependent upon capability, and go immediately to the subsequent exercise. Upon finishing all 3, holds relax for 60 to 90 seconds. Perform for 2 to 4 circuits based on fitness level and available time. Maintain consistency in sessions. Regularity and incremental advancement are essential for adaptation. Illustrative session frameworks. Novice very deconditioned warm-up for 3 minutes. Hold uphill push-up for 15 seconds. Maintain incline plank for 15 seconds. Do wall squat for 15 seconds. Take a 90-second rest. Execute 3 rounds. Engage in a 3-4 minute cool down with mild stretching exercises. Beginner moderate warm-up duration of 3 minutes. Hold a knee push-up for 20 seconds. Maintain a straight arm plank on knees for 20 seconds. Sustain a bodyweight squat hold at mid-thigh for 20 seconds. Rest for 75 to 90 seconds. Execute 3 repetitions. Intermediate warm-up duration of 3 minutes. Hold a full push-up or low incline for 30 seconds. Maintain a straight arm plank for 30 seconds. Sustain a squat hold to parallel for 30 seconds. Rest for 60 seconds. Execute 3 rounds. Advanced warm-up for 5 minutes. Maintain a full push-up position for 45-60 seconds, or include single leg offsets. Sustain a straight arm plank for 45-60 seconds with intermittent short limb lifts. Execute single leg or deep squat holds for 45-60 seconds as suitable. Rest for 45 to 60 seconds. Execute 3 to 4 repetitions. Principles of progression advancement must be intentional and tailored to the person. Gradually extend the hold duration around 3 to 5 seconds weekly while maintaining impeccable technique. Gradually decrease rest intervals in modest increments 10 to 15 seconds until hold lengths are manageable. Transition to more demanding variants after current holds can be sustained for 60 seconds with consistent alignment. Intentionally introduce little instability, such as a narrower foot stance or limb elevation or unilateral loading, to enhance neuromuscular demand. Alter the joint angle to focus on strength at certain segments of the range of motion, e.g. maintaining a squat at a somewhat higher or lower position to accentuate particular ranges. Example of a 6-week progression detailed, weeks 1 to 2, frequency, 2 sessions each week. Isometric exercises incline or knee push-up holds incline, plank wall squat. Duration hold for 10-15 seconds. Complete 3 rounds. Rest for 90 seconds. Weeks 3 to 4, frequency 2 to 3 sessions each week. Holds advances towards the standard position, reduced inclination, abbreviated knee support. Duration, hold for 20-30 seconds. Complete 3 rounds. Rest for 60-75 seconds. Weeks 5 to 6, frequency 3 sessions each week according upon tolerance. Positions, complete push-up hold or mild incline, straight arm plank bodyweight squat to parallel. Duration hold for 30 to 45 seconds. Complete 3 rounds. Rest for 60 seconds. Implement mild unilateral tasks, single leg heel contact in plank short foot, lift in push-up hold for advanced participants. This 6-week period may be repeated or modified based on individual advancement. If a hold induces joint discomfort, regress to a previous progression step and augment volume by rounds instead of extending single hold time to safely enhance capacity. Prolonged and personalized modifications. Individuals do not advance at a same rate. Modify frequency, duration, and variety according to felt exertion, quality of form, and the lack of joint discomfort beyond anticipated muscular weariness. A 12-week regimen generally reiterates and expands upon the 6-week framework, including progressive augmentations in hold duration and diminutions in rest intervals, while also potentially integrating supplementary functional activities such as step-ups, loaded carries, or resistance band isometrics under expert supervision. Safety surveillance and specific factors. Breathing consciously, refrain from breath holding. Maintain a consistent rhythm of inhalation and exhalation, breathe in through the nose and out through the mouth. Counting audibly or internally might assist in maintaining rhythm. Blood pressure and cardiac risk. Isometric contractions temporarily elevate blood pressure. Individuals with unmanaged hypertension or previous cardiovascular incidents should seek medical consultation. Cease all activity immediately and seek medical attention if you have lightheadedness, chest pain, new palpitations, or severe shortness of breath. Differentiating pain from exertion, anticipate muscular weariness and a burning feeling in engaged muscles. Acute joint discomfort, escalating edema or paresthesia are indicators. Cease activity and reevaluate technique or seek medical advice. Postoperative and joint replacement instructions. Adhere to procedures provided by the surgeon or therapist after joint replacements. Gentle isometrics are often started early in rehabilitation. Nevertheless, progression must be tailored and well supervised. In cases of arthritis and tendon disorders, isometric exercises may be safely used if the selected joint angle does not elicit discomfort. Refrain from deep postures that exert pressure on an inflamed joint. Minor modifications in joint angle often allow for safe loading. Balance and fall risk. Some grips may be a challenge to stability. Commence next to a stable surface or wall and contemplate guided sessions until stability improves. Utilize a chair for assistance during squat holds if necessary. Troubleshooting and prevalent errors expanded. Irregular respiration. Establish a cadence. Inhale for 2 seconds, exhale for 2 seconds. Gentle vocal enumeration often inhibits breath retention. To mitigate early tiredness and form deterioration, reduce the length of single holds and increase training volume via extra rounds, emphasizing quality over quantity. Wrist pain during push-ups or plank holds. Use incline variants. Go to forearm planks, execute on fists, or employ a wrapped towel to minimize wrist extension. To alleviate knee discomfort during squats, lower depth. Use wall sits or box-supported squats. Evaluate foot positioning and ensure steady progression. Strengthen hip abductors to address valgus inclinations. Indicators of shoulder impingement. Refrain from postures that elicit discomfort. Choose inclined grips, engage in scapular stability exercises, and seek guidance from a physiotherapist for rotator cuff fortification and mobility enhancement. Monitoring progress and quantifiable metrics. Clear, uniform measurements facilitate the assessment of adaptation and encourage sustained compliance. Hold duration record the time maintained with proper form for each exercise. Quantity of quality rounds accomplished within designated timeframes. Advancement in this area indicates enhanced physical endurance. Rate of perceived exertion, RPE, using a 0 to 10 scale to monitor subjective difficulty. Sustain a goal challenge level, e.g. RPE 6 to 8, and modify progression as necessary. Functional assessments timed up and go, 30-second sit to stand, count 5 times sit to stand timing, stair climb duration and gait velocity, demonstrate practical improvement. Balance measurements such as single leg stand duration tandem stance and recovery time from minor perturbations are valuable supplementary measures. Regular reassessment doing functional tests every 4-8 weeks provides objective feedback and informs programming adjustments. Incorporating isometric exercises into comprehensive fitness regimens and everyday activities. Complementary activities integrate isometric exercises with mild to moderate aerobic activities, such as walking or cycling 3 to 5 times a week to promote cardiovascular health. Incorporate regular mobility and flexibility exercises to maintain joint range and movement quality. Daily integration. Execute brief holds at common intervals, e.g. a 20-30 second wall sit during commercial breaks, a 15-second plank while awaiting water to boil to enhance frequency and compliance. Functional application exercises that replicate daily activities such as half-sit, holds from a chair, and pushing against a hefty door frame while stabilizing the trunk to optimize transferability. Equipment alternatives. Economical implements like a sturdy chair, a solid bench, resistance bands, or a rolled towel may enhance adjustments and facilitate advancement. Details on warm-up and mobility. A targeted warm-up prepares the muscles and nervous system for static loading while reducing the risk of damage. Alongside the aforementioned 2 to 3 minute warm-up, consider incorporating ankle mobility exercises, dorsiflexion slips, or weight shift lunges for 8-10 repetitions per side to enhance squatting mechanics. Hip openers, figure 4, glute stretches, knee to chest stretches or moderate variants of the world's greatest stretch, 6 to 8 repetitions each side. Thoracic rotation mobilizations do sitting or supine rotations, 10-12 repetitions per side to enhance upper body reach and optimize chest posture. Shoulder warm-up do controlled shoulder circles, scapular retraction and protraction exercises, and band pull-aparts, 10-15 repetitions to prepare the shoulder complex. Dynamic balancing exercises, marching in situ, heel-to-toe ambulation, or tandem stepping for 30-60 seconds. Recovery and cool down. Gentle static stretches performed without bouncing facilitate healing and enhance flexibility. Doorway chest stretch 30 seconds on each side to alleviate anterior shoulder tension. Standing quadriceps stretch 30 seconds each leg for anterior thigh alleviation. Hamstring stretch sitting or standing 30 seconds for each leg. Child's pose or kneeling hip hinge, 30-60 seconds for posterior chain relaxation and nervous system modulation. Diaphragmatic breathing, 1 to 2 minutes to reduce heart rate and alleviate stress. Notes on nutrition, hydration, and recuperation. Exercise adaptations transpire beyond the training period. Facilitate recuperation through sufficient protein consumption. Appropriately distributing protein across meals facilitates muscle recovery. Older persons often need elevated per-meal protein requirements to counteract anabolic resistance. It is advisable to visit a qualified dietitian for personalized guidance. Hydration, ensuring sufficient fluid consumption before, to, and after workouts to enhance performance and recovery. Sleep and stress management significantly impact adaptation and recovery. Emphasize regular high-quality sleep. Anti-inflammatory strategies for persistent joint pain. See a doctor on safe approaches. Strategies may include weight management, suitable analgesics, and tailored treatment instead than indiscriminate avoidance of advantageous loading. Adjustment for prevalent clinical problems, concise guidelines. These recommendations are generic and do not substitute for personalized medical or rehabilitative counsel. Knee osteoarthritis, prioritize wall sits and box-supported holds at acceptable knee angles. Refrain from doing deep, uncomfortable squats. Highlight gluteal engagement and deliberate foot positioning. Advance gradually and concentrate on pain-free ranges of motion. Total knee arthroplasty post-operative, adhere to the guidelines established by the surgeon and physical therapist. Early quadriceps activation and restricted range isometric exercises are often used. Unsupported deep squats should be avoided unless expressly permitted. Hip replacement, adhere to weight-bearing restrictions. Initial isometric exercises often include stimulation of the gluteal muscles and hip abductors with restricted hip flexion. Rotator cuff tendinopathy, refrain from postures that elicit acute discomfort. Prioritize scapular stabilizers and low-incline push-up holds with concentrated scapular control. Include rotator cuff eccentric and concentric exercises under expert supervision as tolerated by discomfort. Balance impairment, execute holds in proximity to a robust support structure. Progressively diminish the foundation of support and perform unilateral skills under supervision when suitable. Motivational tactics, adherence techniques and safety protocols. Behavioral techniques improve sustained compliance. Establish quantifiable time-bound objectives, extended durations, more repetitions, enhanced functional assessment times. Maintain a simple workout diary to document holds durations and rate of perceived exertion (RPE). Acknowledge modest improvements on a weekly basis. Combine exercises with routine activities, e.g., doing a plank after cleaning teeth to cultivate automaticity. Utilize reminders, timers, or alarm applications to prompt short daily or numerous practice sessions. Pursue group courses, a training partner, or a coach for social reinforcement and accountability. Contemplate many supervised sessions with a certified specialist, particularly in the presence of numerous health problems or intricate mobility challenges. Exemplary daily and weekly schedules. Minimal time and upkeep 3 days each week. Warm-up duration, 3 minutes. 3 rounds, push-up hold for 20 seconds, plank for 20 seconds, squat hold for 20 seconds. Allow a recovery period of 60 to 90 seconds between rounds. Cool down for 3 to 4 minutes. Moderate progression 3 to 4 days per week. Warm-up duration 4 minutes. 3-4 sets. Push-up hold for 30-40 seconds. Plank for 30-40 seconds. Squat for 30-40 seconds. Allow a 60-second rest interval between rounds. Incorporate 1 mobility-centric activity weekly and 2 30-minute aerobic workouts on non-consecutive days. Advanced integration 4 to 5 days per week. Combine isometric circuit training days with mild dynamic strength exercises such as step-ups, weighted carries, and resisted band work and balance training. Ensure the inclusion of a minimum of 1 active recovery day focused on mobility and regulated breathing, assessing advantages and pragmatic expectations. Consistent practice often yields improvements in hold length, perceived effort, and functional metrics within 4 to 8 weeks. Initial improvements are mostly neurological, including enhanced motor unit recruitment and coordination, while hypertrophic muscle alterations and bone adaptations develop more slowly over months of consistent loading and adequate nutrition. Realistic results include enhanced proficiency in everyday activities, rising from a chair, transporting groceries, augmented balance, confidence, a reduction in near falls, and enduring improvements in muscle endurance. Common practical questions, isometric exercise frequency recommendations. Many adults benefit from 2 to 4 weekly sessions depending on recovery and activity levels. Can I do holds daily? Low-volume holds may be done often for maintenance while high-intensity sessions need rest. Is gear necessary? Negative. A sturdy chair, wall, or bench will do for most workouts. Resistance bands provide options but are not necessary. In agony, what should I do? Differentiate acute joint pain from muscle fatigue. If pain returns, stop and adjust or visit a doctor. In summary, isometric strength training is a practical and effective way for over 50s to retain functional autonomy. Isometric holds are flexible, easy, and light on the joints. They improve upper body core and lower body strength, spinal stability, and bone health via weight-bearing postures. Push-ups, planks, and squats work together to improve muscular endurance, neuromuscular control, balance, and postural stability. These holds may be varied from wall-supported to entirely unsupported, enabling people of all mobility and fitness levels to comfortably participate and progress. This strategy seeks physical independence, a strong, capable body that satisfies daily needs and reduces reliance, not sports performance. Before starting a new fitness routine, especially for those with chronic health issues, recent surgery, or uncontrolled cardiovascular disease, consult a doctor or certified physical therapist to ensure safety. Isometric exercise may help older people stay active, self-assured, and independent by concentrating on technique, breath control, moderate development, proper recovery, and nutrition. Thank you for watching the video. Please let us know your thoughts, and goodbye for now.